Yeah, so this is also a study about which we're very excited because we believe that may be potentially practice changing. As you all know, CAR T have completely revolutionized treatment and life expectancy of patients with relapsed refractory large B-cell lymphoma. And we experienced almost a 40% cure rate in this very high risk and heavily pre-treated population. But now that we have more follow-up with different types of CAR T therapies, we start to appreciate some toxicity about which we'll need to learn more. So it's very interesting. If you look into the ZUMA-1 study, which is the registration study for the axi-cel product, around 30% of patients develop grade 3 or higher cytopenia at time of first response assessment, which is day 30. And when we have these patients that achieve CR with CAR T, but they have cytopenia, clinicians are always concerned because they wonder whether that's an indirect sign that there's some persistent disease in the bone marrow, or that these patients are at higher risk of subsequently developing myelodysplastic syndrome, or they may just be at higher risk to subsequently develop severe infections. So we had the fortune at our institution to have a very special subset. It's a small group, but very special, 31 patients who were treated on trial with axi-cel product, in whom we performed every 3 months after infusion of CAR T flow cytometry on peripheral blood so that we could monitor lymphocyte subsets. Of these 31 patients, about half developed cytopenia of grade 3 or higher at day 30. And it's interesting, the baseline factors, they favor development of cytopenia, where, of course, number of previous therapies, worse performance status, but also lower ALC. They may just point toward the fact these patients were just weaker to start, but those are also factors that in the autologous transplant world are associated with a higher rate of engraftment. So I'm saying this because our hypothesis that, of course, needs to be validated with more functional studies is that patients in whom CAR T cells are more effective may try, every time a B cells try to form in the bone marrow, may try to kill the B cell, but then as a side effect, the CAR T cell will also produce cytokines and chemokines in the bone marrow, inducing myelosuppression. So as a second step, we try to see whether having cytopenia after CAR T would associate, as I mentioned before, with a higher risk of MDS or infections, or just a worse outcome in general. Actually, we did not see any concern for higher rate of MDS or infections. And then finally, and actually, sorry, going back to outcomes, progression-free survival was no worse, if not even a little bit better, but the population sample was too small to identify statistical significance. And then finally, as I mentioned, we measure lymphocyte subsets every 3 months for a very prolonged time. And that's probably one of the most interesting findings from our study. What we saw was that while CD8 and NK cells recovered to normal values in 100% of patients by year 2, CD4 did not recover in up to 14% of patients to normal after 2 years from CAR T infusion. So this is very important because what we know from the HIV experience is that a CD4 count less than 200 is associated with a higher risk of opportunistic infections. And in fact, in our patients, we do see, while we don't see bacterial or fungal infection beyond 6 months from infusion, we see viral infections even 2 years, 3 years out, CAR T infusion. So this, of course, raises the question, how shall we manage antimicrobial prophylaxis? And of course, all the institutions need to put together their experience and come up with international consensus on what to do. But we think that it may be important to at least monitor CD4 in these patients and make decisions about at least antiviral prophylaxis and also anti-PJP prophylaxis based on CD4 levels. And finally, as I mentioned, from our perspective, it's very important to understand what chemokines and cytokines released from CAR T cells are responsible for this myelosuppression, and we're actively performing some functional studies at our institution to answer this question.